think I am live. Hi, so I am doing a live today on the competencies of a trainee clinical psychologist. So I have been speaking to lots of aspiring clinical psychologists about their applications, and hello Priyanka, hello Sophia, hi, and I have been reflecting with them on the skills and competencies that are required as a trainee clinical psychologist, and thinking with them about incorporating those skills and competencies into the application. Because let's face it, the application is asking you questions about what you can bring to the clinical psychologist, the trainee clinical psychologist role, and asking you how your experiences will make you a better candidate. And so, naturally, by being able to communicate that you've got some of those competencies, or that you're aware of the competencies of a trainee clinical psychologist already in your application, is going to lead to you getting those kind of tick marks by your name, or getting points when it comes to the shortlisting process. So I did a Tuesday poll last week, and this is the topic that came up as well. So it's not just something that I've been talking about with people that I support personally, but it's also something that's come up with you, the community. So I've put together a post, but before I put it out, because it's very brief, I wanted to just have the opportunity to expand a little bit more on the competencies, and just clarify a little bit that, these competencies are expected of a trainee clinical psychologist. So if you're applying, yes, it's really important to demonstrate some of these in your application, but to remember that, if you haven't got lots and lots of experience in all of these areas, that's okay. It's about kind of reflecting on the experience you do have, and bringing that to your application. So without further ado, I'm going to start going into the competencies, the 12 competencies of a trainee clinical psychologist. And, this isn't going to be an exhaustive live. I don't want to make it super, super long. But again, it's just about kind of expanding a little bit on the 2 or 3 lines that I was able to put in the post, essentially. So the first one I wanted to talk about is equality and diversity. And what I've written down is that it's the awareness of the impact of difference on self and work. So it's about bringing your experience, personal experience, or working, clinically, or just work wherever you're working, about incorporating the idea of difference and diversity into your work, and reflecting on that, thinking about the impact of that on your work, but not only for you, but, in terms of the people that you support. And also, maybe groups, and perhaps even your colleagues. So thinking about bringing in a diversity and similarity and difference into your work, and developing that understanding of how it impacts people's perspectives, and how it might influence you and your work, and how you might address when there is difference, or perhaps you don't know whether there's difference, how you might be curious about, exploring difference and how it impacts people and their work. And looking at both positive and negative discrimination, and thinking about, why we have positive discrimination. I don't know if it's called that anymore, but why we have that, and, the grounds on which we promote kind of certain initiatives based on, people's difference, particularly from marginalised people from marginalised backgrounds. So some reflection of that in your interview, in your application would be really great. Psychological intervention. I've written ability to apply theory to practice and adapt interventions to meet individual needs. So I know that some of you will, particularly if you're in an assistant psychologist post, some of you will have had the experience of developing interventions and perhaps being informed by formulation. Some of you won't have, but just if you've observed theory and practice being used, then that's also a way of kind of reflecting on your experience of psychological intervention. And this is about really thinking about what models are you being informed by, what theory are you being informed by, and how are you kind of helping this person based on the theory. Why is it that you're using this theory? So some awareness of being able to use theory and incorporate that into the work that you're doing, and understanding why you're using that theory. Is it that it's recommended by NICE guidelines? Is it that in this particular group, it's this particular model is indicated as helpful? Why is it? Some reflection of that would be really, really great. And also some thought about how you might end therapy as well. So, and then the issues around that. So, thinking about how you might, explore and demonstrate that you've had an input in psychological interventions, even if it's not directly, but you've had some thoughts about it. Maybe you've made some suggestions in multidisciplinary team meetings, things like that. Really reflecting on kind of psychological intervention skills, but really it's about thinking about theory and how we apply that to the work that we do and the practice that we do. Using supervision. So again, some people, particularly in kind of those more assistant psychologist roles, might have had clinical supervision before, but some people might not have, and that's okay. I think as long as, ideally, of course, you want to have some clinical supervision, because it gives you the experience of talking about cases, but not only talking about the content of the work that you're doing and the theory that you're using, but also the process. So thinking about kind of the dynamics within the room and how you could be the person that the person you're supporting needs you to be. What do they need from you, or how you're responding to them, thinking about transference and counter transference and things like that. Some people would have had that experience before, and if you haven't, that's okay, because part of this supervision competency is just being able to, I guess, understand that supervision is about learning, and understand that supervision is a place that we reflect, and the setup of it as well. So thinking about contracting and how we use supervision. So just being able to reflect in your application about using supervision, how you've used it before, and being kind of very explicit in saying that you use it to reflect, and that you're using it to develop and grow, that there's contracts, getting to know your supervisor, things like that are really important to mention in your application. Let's have a look. So next, Therapeutic Alliance. So builds and navigates relationships with service users and colleagues. So this is really about focusing on what it takes to connect with people. Think about those skills that you will inevitably have as an aspiring psychologist: skills of empathy, skills of communication, and being able to, I guess, formulate what people are motivations are, and helping that and using that to help you empathize with them and their position, not only with people that we're supporting, so service users, but also with colleagues, and people outside of the organization. How is it that you're using your skills to almost boost the experience of the people that we're seeing, your relationship skills, because we know that connecting with people is so vital, and we can actually ask quite a lot of people and support people in a much more in-depth way if we're able to connect with them therapeutically, particularly. So what is it that you're able to bring to that? Are you an empathetic person? Are you somebody who knows how to manage your tone of voice? Are you somebody who can pick up on facial expressions, etc., to support you in connecting with people and building a therapeutic alliance with other people? I'm just scrolling to see my notes. Also thinking about boundaries. Boundaries are also very important in setting a premise for the work that we do and protecting ourselves, but also protecting the people around us, so that they know what's expected of them, and it's more clear for them what's expected, and what the boundaries are. So some reflection around professional boundaries and personal boundaries would be really helpful as well to reflect on in your application. Thinking about challenging situations is particularly helpful, because it can help you to reflect on when things are tough, how do you respond, and what did you learn from that? how might you approach a situation differently. And you may not break down all of these situations in your actual application, but it's important that you reflect on these situations, and from reflecting on those situations, hopefully you'll find that you sort of think about, what skills you have or what things you've taken away that will equip you for dealing with them in the future, when they potentially come up. And that's really important to reflect on again in the application. The shortlisters want to know about that. Psychological assessment is that process of gathering information. So thinking about how you have gone about gathering information before, when you're working with a particular case. Have you been able to use multiple sources? Have you been able to contact people outside of your organisation again? And also thinking about how you use tools, or how you select tools to get to the root of what you're looking for. So that ability to think, okay, well, this is what the person is coming with, this is what the referral maybe says, or this is the limited information I have, but I want this information. So how do I go about getting that? If you've explored that, or if you've done that before, it's really helpful for you to, again, be putting that into your application, that you know, to demonstrate that you have those skills of assessment already. And also kind of being able to reflect on and interpret the results of that assessment, and to communicate it in some way, whether that is in a multidisciplinary team meeting, or whether that is in an assessment report, but being able to kind of go along that whole assessment trajectory. So from getting the referral in, to being able to select tests and find out additional information from other sources, to being able to interpret it, and then being able to disseminate it, are really important things to be able to reflect on in your application. This also includes risk assessment as well. So it's important to think of that as well. And also neuropsych assessments, if you've had the experience of conducting those. Psychological formulation is comes quite nicely after assessment, actually, because from the assessment information, often we put together a way of understanding the presenting issues that the person is coming with. So formulation is something that I'm aware that it might be helpful to do another one of these lives on, or to have some information around, because it's one of those areas that a lot of people find tricky. So if you do find formulation a little bit tricky, you're not alone. And I definitely found it tricky to grasp. But a formulation essentially is just a sort of direct, a simplified way of understanding what is maintaining the difficulties that somebody is having. And we often use theory to help us to understand, and of course the assessment information. So we take that assessment information and we plug it into a formulation, and formulations can look very different depending on the model that you're using. Frank, I can see you're saying me too. Thanks for identifying with these feelings with me. So yeah, formulation is just about it's about plugging in the information from the assessment, thinking about theory, and thinking about how these different things link together. So what was somebody's what somebody's kind of previous experience or early experiences, what's their attachment style, how might that impact on how they take certain situations, which might trigger certain feelings, and might lead them to behave in a certain way, which then maintains other feelings and other behaviours, which maintains a difficulty. That's essentially what a formulation is, and we're using formulations to guide our intervention. So if you've had experience of talking through a formulation, helping to develop a formulation, which is a way of understanding people's difficulties, then definitely we would want to see that in the application, and your reflections of using formulations as well, and also reformulation. So when things change, if there's a difference, being able to identify that, okay, things are slightly different, or maybe things aren't working, let's sit down, let's rethink things, let's reformulate. So having experience of doing that and reflecting on that in your application is really key. You might want to reflect on kind of one-to-one formulations, but you can also think about how you formulate a group, with your therapy cases, or you could think about your teams that you work in, or the organisations that you work in. You could formulate an issue that's going on. These are all ways that you can kind of practice using your formulation skills. If people do want more information on formulations, it would be so helpful if people could just message me any questions that they have, and it will help me to frame how I talk about formulations, if that makes sense. That's psychological formulation. Effective communication, so adapts written and oral communication style according to audience and context. As a clinical psychologist, I do a lot of communicating with lots of different types of people, from sort of working with service users and explaining psychological terms to them, explaining what models we're using, teaching and training. I work with parents, and so communicating with parents sometimes requires a different tack, particularly when there is, depending on the relationship to help, it can sometimes affect how I approach situations, and being able to kind of understand that or kind of, play around with how you communicate with people to make it the most effective it can be is another thing to reflect on. So have you delivered training, or have you delivered teaching or pieces of work to different groups of people, for example, which would require different communication styles, and reflecting on kind of written communication style as well. Have you perhaps written a report for somebody and then written a more accessible report, or have you found that there's something, an information sheet that's written in your service that might not be understood by a particular group, so being able to really kind of adapt and tailor what your communication is like depending on who you're talking to. Another kind of difference, or a different way that we might communicate is with other colleagues. So we might communicate psychological terms to colleagues that aren't trained in psychology in a particular way, and that might be different to when we talk to other trainee psychologists or other psychologists. So it's really about adapting communication style, being able to communicate clearly, so that people are understanding, and being able to check in to make sure that people are understanding. So that kind of thing is expected of a trainee clinical psychologist, and if you've done that in your past, in your experience, which I'm sure everybody has, then it's important to reflect on that in your application. Okay, last two, clinical research. So this is an area that I have found when working with aspiring psychologists that people often feel quite daunted by, and I think I don't know why it is, because everybody that I've spoken to has some research experience, but a lot of people just feel a bit daunted by presenting that research experience, or feeling like they would like to have more research experience. But if you think back to your undergrad, and the study that you did, chances are that that's basically all you need in terms of research experience, because you would have thought about designing a study, potentially, well, thought about it with at least a tutor, designing a study, what tests would be needed to do the study, or what method you would use to do the study, and then you have written it up and hopefully disseminated it in some way, although I'm aware some people might not have done that. So being able to do all of those things are their skills. And I'm just trying to think, how would people kind of reflect on that? Just thinking about, I guess, that process of how did you choose one method over another method? What were you trying to study, and why was it that you chose that method over another one? And if you have a think back, maybe even read your undergrad dissertations again and have a think back to that time when you were doing it and the justifications that you use, and hopefully you've even written your justifications in your methods section, or you've alluded to them in your introduction section, as to why you've chosen that particular method. So that process of being able to design and select and then conduct research is important for people to reflect on. Just having a look at some more notes. Yeah, another thing to talk about is if you have ever done a service evaluation, so trying to understand whether the service that is being provided is actually being provided and if it's effective. So, you know, and if people are meeting kind of targets in terms of that intervention. So if you've ever done sort of a service evaluation where you've looked at, for example, I did a service evaluation on, what was it? The recovery model, and whether or not the service that I was in was actually adopting the recovery model in the way that it had proposed to do that. So whether or not we were getting those goals in specific ways, whether or not we were getting them in a timely fashion, whether or not they were being reported, all of those things contributed to the service evaluation. And, you know, how I went about doing that in terms of collecting the data, you know, organizing the data, those are all really important skills. And I think people don't realize maybe how important those skills are, and maybe downplay them from doing them in their undergrad. But those are really important skills to be able to procedurally go through the research process. So don't downplay them in your application. Talk about them as, you know, as they are. They're really important skills. So being able to demonstrate that you're able to do that, and even write it up as well, is really important to reflect on and to demonstrate in your application. And the last, critical evaluation, which is kind of similar to clinical research, but it's distinct in that it's looking at the outcomes of your specific pieces of clinical work, or just you're looking at things in a way where you're almost evaluating them, or evaluating is definitely in the title. You're weighing up how good they are, essentially how good they are. So an example is kind of collecting ROMs, routine outcome measures for the interventions that you're doing. Maybe you're collecting them for another member of staff, and looking at how they might change over time, which indicates whether or not things are helpful or not. You know, that's one example of critically evaluating a clinical intervention or clinical work. Another way of demonstrating clinical evaluation, or critical evaluation, is in thinking about when you're reading research, when you're reading an article, thinking about, you know, what are the benefits and drawbacks of that article? Do they apply to the particular client group that you're working with? You know, so being able to, because we're informed by research as clinical psychologists, but very rarely is the research perfect for the person you want it to apply to. So a good example is that, you know, I work with children with learning disabilities, and, you know, there's a real shortage of research in this area, which is why I'm really working towards, you know, hopefully collecting data and publishing on some of the work that I'm doing. But often we're needing to apply other types of research, or research applied in different cohorts. So, for example, adults with learning disabilities, we might be informed by that research, but looking at it with a critical eye. So knowing, okay, well, you know, we're not working with adults, so how would we look at this or use this research, but not take it as gospel because it's not necessarily applying to our age group, for example. So being able to critically look at information and think, yeah, that's good, but does it apply to this? Or, you know, asking questions about it and staying curious is an important thing to reflect on. And again, it's an important thing to kind of think about, you know, incorporating into your application if you can. So those are the 12 competencies that I have put into the post, the Tuesday. I can't even say Tuesday. I can write it. I can't say it. Tuesday post. That I just wanted to expand on a little bit more. And as I say, this isn't kind of exhaustive. There's, you know, a lot to kind of think about, and, you know, different people will have different experiences, and so I can't possibly cover all of the experiences that people might have that come under these topic headings. But I just wanted to kind of explore a little bit more, what these mean, and in the hope that it's helpful for people. So yeah, as always, get in touch with me with any questions. I'd be happy to respond and support if I can. But I hope the application writing is going well for people, and it's not too stressful. And if there's any way that I can maybe do one of these lives to kind of support, again, just let me know. And but it's been good connecting with some of you. Thank you, Mandy. And as I say, I will put this up as an IGTV, so if people have missed it, they can see it. Thank you very much, those of you who are here watching, and get in touch if you need anything. Take care, guys. Bye.